Hi everyone, and welcome to Webinar Wednesday. I'm your host Jessica King, and I just wanted to quickly thank you for joining us today. November is Diabetes Awareness Month. This disease affects millions of people just in the United States alone. Today's speaker, family medicine physician Dr. Linda Lee, will give you the breakdown on what diabetes is and some tips on how to prevent it and manage it. Here's a little more info on today's speaker. Dr. Lee is board certified by the American Board of Family Medicine. Her clinical interests include preventative medicine, hypertension, and diabetes. She joined Kelsey-Seybold in August of 2010, which means that you just recently celebrated your 6-year anniversary. Congratulations.
That's right.
And she practices at the Meyerland Plaza location. Don't forget, we'll be taking any questions you have at the end of the webinar. If a question happens to pop up, just type it into your question box, and we will do our best to address it after Dr. Lee's presentation. And now I hand it over to you.
Good afternoon, everyone. I'm Dr. Linda Lee. Thank you for joining me today, and welcome to Kelsey's Health Webinar, Diabetes 101. So practically all of us are affected by diabetes in one way or another. Diabetes is such a widespread disease that 30 million Americans have diabetes. This includes both children and adults. 1.4 million Americans are diagnosed with diabetes every year. Over 86 million Americans aged 20 and older have prediabetes, which is up from 79 million back in 2010. So, what is diabetes? It is the inability to control and utilize, So what is diabetes? It is the inability to control and utilize sugar. Food is converted to sugar by digestive processes. The pancreas secretes insulin, which is a hormone that helps the sugar enter your body's cells. If sugar can't enter the cells, it remains in the bloodstream, leading to diabetes. This can occur through two processes: insulin deficiency and insulin resistance. So your body uses blood sugar, like I said, for energy and for brain and nerve functions. So basically everything that you do on a day-to-day basis. Blood sugar, also known as blood glucose, primarily comes from foods like carbohydrates, proteins, and fats. So when you eat, the food is digested, turns into glucose, which is then brought into the cells for energy. So diabetes, like I said, results from the buildup of sugar in the bloodstream. There are two main types of diabetes, type 1 and type 2. Type 1 is due to insulin deficiency. With insulin deficiency, your body cannot make its own insulin, which results in buildup of the blood sugar levels. Type 2, on the other hand, is different. It's due to insulin resistance. With insulin resistance, your body can make the insulin, but your body's own cells do not respond well to the insulin that you have. So type 1 diabetes, you may have heard of this type referred to as juvenile diabetes or insulin-dependent diabetes mellitus. Approximately 10% of diabetics have type 1. This occurs when the body makes essentially no insulin, and this is usually caused by autoimmune destruction of the pancreatic cells that produce insulin. People with type 1 diabetes are treated with insulin shots or an insulin pump. Type 2. You may have heard of this type referred to as adult onset or non-insulin dependent diabetes. Among people with diabetes, 90% of them have type 2. This is by far the more common type of diabetes in adults, which is why the rest of my slides will be mainly focused on type 2 diabetes. Type 2 occurs when the body's cells are not properly using the insulin that it makes, and so it can eventually lead into your body's inability to make enough insulin for its needs. Type 2 is related to obesity, family history, and has a racial predisposition with an increased risk in African Americans, Hispanics, Native Americans, and Asian Pacific Islanders. Development of type 2 diabetes may take years, and the person may not experience severe symptoms, or in some cases, any symptoms at all. Prediabetes, or some people might call it borderline diabetes. This occurs when the body develops a little bit of insulin resistance. Your body starts having trouble getting the blood sugar levels down to a healthy range. Now, this does not mean that you will definitely develop diabetes, but you are at a much increased risk for developing diabetes in the future if we don't do anything about it. If you have prediabetes, you will need to make healthy lifestyle changes, or you will most likely develop diabetes. You may have heard of another term called gestational diabetes. Gestational diabetes is a development of diabetes during pregnancy. Elevated blood sugars during pregnancy can cause potential harm to both mom and baby. Most women with this type don't remain diabetic after the baby is born, which is a good thing. But keep in mind, a woman who has had this type is at a higher risk of developing it again during future pregnancies. Not only that, they are also at a higher risk for developing type 2 diabetes later on in their life. So can you prevent type 2 diabetes? Yes. Can you reverse prediabetes or type 2 diabetes? Yes. Eating better, becoming more physically active, losing a few extra pounds, all of these, making few simple changes in your lifestyle now, may help you decrease insulin resistance, bring the glucose levels back into normal range, and avoid the serious health complications of diabetes down the road. Because diabetes is so prevalent in the population, it is important to know the risk factors for diabetes. Being aware of which risk factors you have helps you proactively manage and monitor your own health. The main risk factors include being over the age 45, having had gestational diabetes or having given birth to a baby who is over 9 pounds, leading a sedentary lifestyle, being overweight or obese, a family history of diabetes, being of African American, Hispanic, Native American, or Asian American descent, or if you have prediabetes. If you have high blood pressure and or high cholesterol, you also have a higher risk of developing diabetes and other complications. So how do you know if you have diabetes? Well, early in the course, you don't know because you don't have any symptoms. Diabetes is usually diagnosed by screening a fast blood sugar. So this is usually typically when you go into the doctor and they check your sugar after 8 hours without no food or drink. So a fasting glucose of less than 100 is normal. 100 to 125 is pre-diabetes, and 126 and higher is diabetes. About 1/3 of older adults with diabetes are not aware that they have the condition and therefore are not able to take steps to prevent complications. However, there are symptoms that may indicate undiagnosed diabetes. Some of these symptoms include increased urination, increased thirst, increased appetite, weight loss, fatigue, blurry vision, delayed healing, tingling in hands or feet. Diabetes can lead to multiple complications. Obesity, especially abdominal obesity, or they say truncal obesity, is associated with insulin resistance. You may have heard of the metabolic syndrome, which describes the co-occurrence of certain metabolic risk factors that are so important and increase significantly subsequent development of type 2 diabetes and or cardiovascular disease. These risk factors include abdominal obesity, hyperglycemia, which is high sugar levels in the blood, dyslipidemia, high lipids in the blood, and high blood pressure. Criteria for the metabolic syndrome requires 3 out of the following. For the abdominal obesity, it's described as waist circumference in men greater than 40 inches and in women greater than 35 inches. Your serum triglycerides are greater or equal to 150, or if you are on drug treatment for elevated triglycerides. The next one is serum HDL, which is the good cholesterol, is less than 40 in men and less than 50 in women. If your blood pressure is equal to or greater than 130/85, or if you're already on blood pressure medications, and if your fasting glucose is greater to or equal to 100. People with diabetes are more likely to have heart attacks and strokes and complications from poor circulation. Another complication of diabetes is damage to the retina and small vessels of the eye. Symptoms can include blurred vision, narrowed field of vision, cataracts, and difficulty seeing in dim lighting. Diabetes is a leading cause of new cases of blindness among people between the ages of 20 and 74. Diabetes also has the potential to damage your kidneys. The risk of kidney disease goes up the longer you have lived with diabetes, and having high blood pressure as well can make your risk even higher. People with diabetes can lose up to 70% of their kidney function before they even realize it. By then, their kidneys are already damaged. Diabetes can also cause nerve damage, blockage of peripheral arteries, increased infections that can ultimately lead to amputations, and so many other complications. How do we treat diabetes? Sometimes all it takes is lifestyle modifications. Weight loss, healthy eating, exercise are key components to controlling diabetes. If medications are necessary, there are oral and injectable medications that help reduce insulin resistance, some that increase insulin secretion, and others that help reduce the absorption of your sugars. When the glucose levels are too high and the other medications are not working, insulin injections are sometimes needed. Although medications can definitely help bring down the glucose levels, lifestyle modifications are still key to successful treatment. It is recommended to get 30 minutes of physical activity 5 days a week. What is physical activity or getting exercise? Exercise does not have to be high impact or high intensity to be effective. Mild physical activities such as housekeeping, gardening, and brisk walking can improve your cardiovascular system and reduce blood pressure. Aquatic exercises such as swimming or water aerobics are good because they are less stressful on your joints. Dancing is a great physical activity too because you are getting exercise while doing something that you enjoy with your friends, and that helps a lot. Research shows that both aerobic exercise and resistance training can help control diabetes, but the greater benefit comes from a fitness program that includes both exercise. Losing weight, lowering blood sugar, and boosting your sensitivity to insulin, all of these can happen with exercise. In addition, being active promotes good circulation and increases your heart's pumping power and promotes good cardiovascular health. Add type 2 diabetes to the long list of health problems linked with smoking. Smokers are roughly 50% more likely to develop diabetes. It is a myth to think that it is too late to stop smoking. In addition to making the arteries harden more quickly, smoking increases your risk of having high blood pressure and other heart disease. By stopping now, you can reduce your chances of having these illnesses in the future. Speak with your healthcare provider about how to stop smoking because you do not have to do this alone. There are many products and programs available to help you. Making sure you eat a healthy diet is very important. Lean meats and fish are better. Avoid foods high in fat and cholesterol, such as red meat, dairy products, salad dressings, and many desserts. Avoid foods high in sugar, which include frosted cakes, sugary breakfast foods, syrup, and honey. Fiber, fiber, fiber. That is very important in our diet. Foods high in fiber include fruits, veggies, beans, whole grains, nuts, and seeds. It may help you reduce your risk of diabetes by improving your blood sugar control. It will also help lower your risk of heart disease and promote weight loss by helping you feel full for a longer period of time. Try to choose whole grains. Whole grains may reduce your risk of diabetes and help maintain blood sugar levels. Try to make at least half your grains whole grains. Many foods made from whole grains come ready to eat. Various breads, pasta products, and many cereals do too. Look for the word whole on the package and among the first few items in the ingredient list. If you are overweight, diabetes prevention and treatment may hinge on weight loss. Every pound you lose can improve your health. Participants in one large study who lost a modest amount of weight, around 7% of their initial body weight, and the same group of participants exercised regularly, they were able to reduce their risk of developing diabetes by almost 60%. And if you already have diabetes, sometimes losing just 10 to 20 pounds can be enough to bring your diabetes under control. Depending on the amount of weight loss you have, you may be able to decrease your insulin amount and or decrease the dose of your oral diabetes medications. Management of diabetes is key to helping you stay healthy. Lose weight, take your medication, check your blood sugars, keep your doctor's appointments. We typically see our patients every 3 months or so. We will usually check a blood test called hemoglobin A1C. You might hear us call it A1C for short. This is a test that tells us how your sugars have been ranging over the last 3 months. It really helps us in treating your diabetes and kind of getting the sugars under control. Make sure you're alert to kidney disease. This is usually checked by in the doctor's office with a blood test and with a urine test. Make sure your eyes are in check. Make sure you go to the eye doctor because the sugars can definitely affect the arteries in the back of your eyes. And you don't really see it, and you might not have any vision changes. You just might have some problems back in the arteries. Make sure you keep your feet healthy. Diabetes patients can have dry and cracked skin, causing increased possibility of infection. So make sure you moisturize and check your feet. Sometimes people lose their sensation in their feet, so they might have, stepped on something and stubbed it against something, and it could get infected really easily, and you might not know it. So it's always important to check your feet and look for any possible, open sores or any infections. Make sure you also go get your routine dental exams. The main important thing, though, I think, is not just doing all these things, but you need to get involved in a diabetes management program. This can be with your doctor, certified diabetes educators, diabetes education classes, and registered dietitians. Each of these different specialists are available and have a lot more help with tips, with different insight on how you can take everything together and manage your diabetes. With the help of all of us healthcare professionals, we can help closely monitor your labs and your glucose levels, but we actually need your active participation to make it successful. It's basically teamwork. You do your part, we try to do ours, and together we can help beat diabetes.
All right, so it looks like we have some time for questions. I want to start us off real quick just to give people time to type theirs in. Is there anything that you can do if your blood sugar suddenly drops and you're diabetic? Are there steps you can take to kind of bring it back up in a safe way?
Yes, if you somehow develop a low sugar, usually the symptoms of what we call hypoglycemia or low blood sugar, the symptoms of hypoglycemia include excessive fatigue. You feel really lightheaded. You can feel shaky, sweaty, clammy, cold, and really, really hungry and really, really weak. If you feel these symptoms, you definitely need to check your sugar, and you actually need to bring up those sugars because low blood sugars can cause damage too. So you can either choose to eat a hard piece of candy, you can drink a half cup of juice, or they do sell glucose tablets for those who actually need a higher amount of sugar to bring up the levels quickly. Oh, let me see. Sorry. Let me take a look at all the questions. Can you repeat the statement about tingling? So, sure. So I think I mentioned the tingling when I was talking about potential complications of diabetes. In diabetes patients, you can get numbness and tingling in your hands and or feet. Now, this happens because it's basically the high sugar levels can cause damage to the little nerve endings in your hands and feet. And so people might feel numbness and tingling. It can be numbness and tingling only, or sometimes people feel like it's a burning pain and it's just all the time. Now, the main important treatment for that is to bring the diabetes in control and make sure that the levels are good, but there are medications as well that can help decrease that that symptom. Let me see, what else? I went to lunch and then had my blood work done, and the results stated that my sugar was 121. Now, diabetes runs in my family, and I have been acutely aware of that, and that is why I'm very active and watch my diet. Should I be concerned about the 121 level? Good question. So it depends. It depends on when you actually checked your sugar. So if you checked it right after you ate, then that's not really accurate. We technically like to check one of two things. One is, the first one I mentioned before, it's a fasting blood sugar level, so you need to be fasting 8 hours, no food or drink, just water. That kind of tells us approximately how your sugars are ranging. The other glucose that you can check is 2 hours after you've eaten, whether it's lunch or dinner or breakfast, and that can kind of help tell us if you have some insulin resistance or not as well. So if the sugar levels 2 hours after you eat are greater than 140, it's a bit on the higher side, so we definitely have to be careful, and we would have to probably check an A1C on you and kind of monitor it. Let's see, another question. Let's see. If after 2 hours the test comes back at 161, is that really bad? And how long is that level considered bad to have after eating? What if the next morning the test says 106? So that's a little bit more complicated, but good question. So we would love your morning blood sugars to be less than 100. If you are already on a medication, there's one called metformin. If you're already on that medication, before increasing the dose, I probably would have you work on your diet and your exercise just to kind of help the insulin work better and bring down the sugars first. For the 2-hour glucose level, exercise and watching exactly what you eat, decreasing the carb amount when you're eating, and making sure you have enough fiber and protein to help you kind of digest the food kind of slower. That would be a good thing to do first. Let me see if there's any other questions.
I have a question, if I can just
Sure.
chime in. So you mentioned that medications could be used to manage diabetes, along with, of course, healthy lifestyle changes.
Correct.
Can you take oral medications and insulin at the same time to manage it, or is that a little bit on the dangerous side?
It is a bit, it can be a bit dangerous. We do have a lot of patients who are on both oral medications and insulin. We just have to be careful because some types of oral medications can lower blood sugar levels really fast, and so what we want to avoid is insulin helps lower the sugars as well. So if you're on two similar types of medications, whether they're injection or oral, we do not want your levels dropping so low, because that can cause fainting, that can cause coma, that can cause a lot of other issues.
Okay, I have another question for you.
Yes.
So we talked mainly about type 2 diabetes, but I have a question about type 1 diabetes.
Sure.
Do you have any advice to maybe parents or kids that get diagnosed with type 1 diabetes? Because it usually happens in younger children, correct?
Correct.
Okay.
So it usually occurs in younger children when you first get diagnosed, although we do have an adult onset type 1 diabetes as well, who those people are diagnosed a little later in life, but they are the ones who also need insulin. Now, my advice to parents who have kids with type 1 diabetes, there's a lot of resources. Make sure you get in touch with your family physician or your pediatrician. Texas Children's, a lot of Memorial Hermann, like all of the hospitals do have a lot of good programs. I'm part of the American Diabetes Association, and we have amazing programs. We have a summer camp that lets kids stay, go to camp for like a couple of days, and they teach the kids, you know, how to check their sugars, let them know that they're not the only ones. They have, you know, cool celebrities who come and tell them it's okay. They can do whatever they want to do. They just need to know how to manage their sugar levels, and that's the main thing. But there's a lot of resources out there for you guys.
Awesome.
Oh, let me see. One more popped up. I'm currently on daily glimepiride. Should I worry about pancreatic fatigue or any other long-term side effects? Glimepiride is a medication. It's an oral medication, and that one helps kind of the body's pancreas increase the insulin levels so that you can actually bring in the sugars better into the cells. Now, as long as we monitor you and you follow up with your physician, you should be okay. I think if you have a chance to work on lifestyle modifications, if you're obese, if you're overweight, if you your diet is not the best and you're not quite active, it would be really good to kind of work on that to lower the sugars and potentially maybe get off of the glimepiride. But yes, with glimepiride, sometimes we do worry if you're on it for like ages and ages and ages, sometimes it can kind of cause the problem of the pancreas might get a bit tired and eventually cause, you know, your body might not be able to make as much insulin as your body needs to at that time. That's a really good question. Another question, is it possible to have neuropathy, pain, and symptoms in your feet without being diagnosed with diabetes? Yes, people can definitely have neuropathy from different types of illnesses, not just diabetes. There are a lot of other diseases that can cause neuropathy. There might be some vitamin deficiencies. There might be some, whether it's B12, you know, whether there's thyroid issues. There's lots of different things that can definitely cause neuropathy. So check with your doctor, and they can kind of do testing. Let's see. One more question. It's the last one, I think. Trying to make a lot of diet changes seems overwhelming. Besides cutting down on sugar, should we just try to limit breads and desserts as a start? Yes, I agree that it is very overwhelming. Even just a normal person who does not have diabetes has trouble. You know, a lot of healthy lifestyle, it's called healthy lifestyle for a reason. It's a lifestyle change, and it is very hard to kind of all of a sudden change all, you know, at one time. I kind of suggest not cutting out everything at once, because what happens is you're good for a while. You can kind of hold off. You crave it, but you don't need it. You don't need it, and then eventually you crave it so bad, or you have a stressful day, or something just wrong happened, and boom, you kind of indulge yourself, and then you go all out, and then you go all crazy about it, and you just overindulge. So it's important to kind of see how your diet is, analyze it out, which is why a dietitian and diabetic educators are hugely important on that. You can kind of dissect it out and see, okay, what kinds of foods do I eat? What kinds of foods do I eat when I'm too stressed? And kind of make little changes first. you don't want to cut everything out at once. If you eat a little bit of bread, then don't eat dessert, just little by little.
All right.
Hope that helps.
I think that is all the time we have for questions. So this is going to conclude our webinar today, and we hope that you have some great takeaways to take with you and help you in the future. I want to say a very big thank you to you, Dr. Lee, for giving such great information. And be sure to join us later this month. We have another webinar for you for Diabetes Awareness Month. It is going to be Wednesday, November 16th, Diabetes, How to Maintain Healthy Habits, and we will primarily focus on dieting and exercise. So you can get all of those questions in on that webinar. And it is going to be with our registered dietitian, Rhonda Elsenbrook. And don't forget to follow us on social media and join in on the conversation. Thanks again for tuning in, and we'll talk to y'all in a couple weeks.
Thanks, guys.